So we've arrived on scene here. The seat is safe. I've got gloves and glasses on, so standard precautions to insert an IV cannula. I'm going to introduce myself to the patient and gain consent and inform them of the procedure. So hi, my name's Reese. I'm from the ambulance service. Just going to insert a cannula to your arm today to administer medications. Is that okay with you? I've gained consent from the patient, so I'm safe here. We've got adequate lighting. The patient's comfortable. They're happy where they're sitting. So I'm going to get all my gear ready. Everything's set aside. So I have my flush syringe, I have my bung, my alcohol swab, my cannula, my tourniquet, some tape here ready to anchor it, and also some gauze to wipe away any excess blood. So we're going to apply the tourniquet, being careful not to pinch the patient's arm for comfort. Once the tourniquet is applied, I'm going to ask the patient to quench their fist to allow me to sort of identify a suitable vein. Now that I've palpated and visually identified a vein, we're going to go with this one here. So we're going to use the alcohol swabs in circular motion from a small circle working bigger. And if I look at the swab and it's dirty, I'm then going to flip the swab and use the other side, repeating the same motion. I'm going to have my flush ready. So the flush is drawn up with saline. It's set aside somewhere clear by when I do flush the cannula. I'm going to insert my cannula, but before I do so, I'm going to warn the patient we're going to have a sharp scratch. I'm going to insert the cannula at 15 to 25 degrees. So I'm going to progress the cannula forward until I see flash in the flashback chamber. And once I do so, I'm going to lower the angle of the cannula and insert 2 to 3 millimeters more. Once that's done so, I'm then going to slide the cannula back until I hear the safety click. Once I hear the safety click, I'm going to tamponade the vein to ensure we prevent any leakage, and I'm going to clack and remove the tourniquet. Once it's done so, I can then remove my cannula, the needle from the vein, leaving the cannula in, and dispose of in my sharps container straight away. Once that's done so, I'm then going to remove my bung from the sterile packet and making sure I don't touch the end and maintain sterility. I'm going to insert the bung on, and then I'm going to have the tape that I prepared earlier to tape down the cannula to the arm. Once it's done so, my pre-set up flush, I'm going to flush the cannula to ensure that we don't have any drawback, any pushback, or any fluid build-up in case I've blown the vein outside of the vein, and make sure everything looks patent. Everything's good. I've got some gauze here, so I'm going to utilize that gauze to clean up any excess blood that has come out if need be. Once that's done, we can dispose of that appropriately too. I'll use my Tegaderm and place it over the cannula, exposing the bung so I have patent access for medications, and also so I can visually see in case we do blow the vein later down the track and then there is fluid buildup.